Now, we're looking at the headlines now. The World Health Organization is warning that the Ebola virus disease could spread faster and wider in Port Harcourt. And maybe the reasons are not far-fetched, but as a public health official, what would be your concerns, and would you say that we really have it under control in Port Harcourt?
I would say we've done what is humanly possible, and it's still ongoing. It's not done. You are not done, you know. It's still, it's ongoing. It's good effort. However, the concern about Port Harcourt is that you have a lot of lapses in time. You know, a man who came in, was treated by somebody, returned. That seemed to be quite okay. But then the doctor who becomes sick, who was visited by several people, who was treated apparently in about 2 places, you know, whose corpse was taken to another place. So you have a lot of places for contact. You have a lot of people who came to his house, people who went to his hospital. I was just reading now about the people who went to pray even in the hospital. You know, so you have a huge number of contacts. Their degree of exposure remains unknown. And indeed, it's perhaps, like I said earlier, it's impossible to tell exactly who and who, you know, came in contact with him when he was sick. That's the critical period you're worried about. When he was sick, that's when he can actually transmit the virus. However, you do things like this, public enlightenment, sensitization, so that people would know, even if they were never tracked, they should actually present themselves. And if all of that is done and everybody just did what they were told to do and don't act like the diplomat, you know, who also was told in the first place, don't do this, don't do that, and went against everything, and also don't act like the doctor who became sick and apparently didn't tell everybody, you know, who was coming near him. I was thinking about that this morning, that there's a huge difference. I don't know what we need to do, but we need to do these things we're doing already. You know, in that Dr. Ken Bradley, the American doctor, a second missionary doctor now recently, they wake up, they discover I have a fever. And the story is the same. They said the man isolated himself and then reported himself, I have a fever. You know, and I'm thinking and I think it might be Ebola, you know, and I'm thinking that's the kind of action you need from everyone. You know, you need them to actually say, I'm sick, I've been in contact with someone with Ebola, I suspect this could be Ebola. So you want everybody around you. You know, you don't expose them. So this doctor was sick, he didn't tell them. He didn't even tell his colleagues who were treating him to say, hey, this is what I did. I'm sorry, but this is what I did.
Yeah, but we also have to ask what the level of enlightenment was, and then check maybe perhaps across the states whether that level of enlightenment is reached there. Because here in Lagos, we've been hearing when people are sick, don't go too close, don't go visiting. Right. If you pray for them, you can pray for them from your home, or, you know, right, send them a video of the prayer. And right, it would seem that people only thought that only applied to Lagos. Right. People didn't take those kind of precautions elsewhere.
I would kind of agree with you that there's been a lot of enlightenment in Lagos. In fact, also I was thinking, not to sound patronizing, but I was thinking that Channels has had this on, for instance, and you're not the only ones. Others have been doing this for a long time, and you're not letting down on it. You know, and that's why we have enlightenment we have in Lagos. But I'm hoping if you have Channels Port Harcourt, for instance, you'll do the same. You understand? If you had the radio stations there, they'll do the same. There'll be a lot of community mobilization like we've had in Lagos. There are people actually going from street to street, you know, who have been mobilized to talk to people. Their educational materials being distributed. We need that same level. I think initially people were thinking that's a Lagos problem. You know, even though we knew it was a national emergency, but they felt that's a Lagos problem, let Lagos solve their problems. You know, and then we pray, you know, like we'll say, God forbid that it will come to us.
Are there any challenges for, public health officers?
Well, there are several challenges. One, like I said, this is very resource consuming. That's why we've heard about African Development Bank, World Bank, all bringing out money, for instance. So this costs a lot of money. If you think about phone calls, if you think about people moving here and there alone, that costs a lot of money. If you think about human resources, that's really challenging as well. For instance, people talk about porous borders. And I say, do you know what it takes to man those borders? Do you know the skill level of people you need? If you even wanted to man the international airport alone, who would you put there? who would be sufficient to screen patients or passengers.
But it's something we need to do, right?
Yes, we need to do it.
Because a lot of people say that we will not be out of the woods yet until other West African countries
absolutely
are free.
Absolutely. We can't sleep well until they are all sleeping well, you know.
But should we be worried about healthcare professionals? I mean, look at two separate instances. One, late Dr. Adedevo, a shining light in her profession, and may her soul rest in peace. And then the other doctor in Port Harcourt. Because if the awareness is not as much in different areas, and then the health professionals who you expect don't need that much awareness, by the way, conduct themselves that way, it raises a lot of questions.
Actually, I wouldn't say that the health professionals don't need enlightenment. They do need enlightenment. There have been a lot of meetings with both private and public health professionals. Okay, and the point being that Ebola is kind of new to Nigeria. So health professionals are just like you and I. They have their own fears as well. It's something they haven't had to deal with. I always like to say we've dealt with the cousin of Ebola, which is Lassa fever. We've had a bit of that in Nigeria. It also kills health professionals, very similar to Ebola. Kills health professionals because they do not suspect initially until it's killed a few people. Then everybody say, hey, you know what, this might be, you know. But then when you, for instance, pick the people who deal with that quite a bit, like in Irua, you know, if you deal with them, they have less fears than the remaining health professionals everywhere else who have never seen anything like this before. You know, so there is a whole training package, for instance, now for health professionals. Again, just to calm their fears, re-emphasize some of the things they were trained to do, to say now this is a reminder that you can't slack out on any of these things. You must practice these things rigidly, as it were, because if you did this, you're likely to be safe, you know, and all of that. So it's tough. It's unfortunately we have both a hero and a villain, but we again, in any profession, you have the same.
There's also this the news item that the federal government is planning to review resumption dates. So even though October 13 was the initial nationally announced date, it would seem that maybe there are thoughts that it might not be as grave as we thought. So perhaps it should be reviewed forward. Is this something that you would advise?
Well, let me say there's been quite some clamor immediately that was announced, by many who were involved in this control effort, that perhaps that should not be so. Given the level of response, the control kind of we have of this situation. So maybe it's not as bad as that. And then given the fact that we are not controlling other gatherings anyway, we are not restricting people going to church, we are not restricting people going to mosque, we are not restricting people going to shopping malls and all of that. So the point is, why restrict the schools? But again, I guess that was done because people are kind of really afraid when it comes to children. What do we do with children? That kind of thing. While on the other hand, the proprietors want their money, which is a concern. However, I think that it has to be a middle ground of some sort. If you want to err, you err on the side of caution, yes, but I think we're on top of this situation, really. And like the report said, there was a meeting with the schools yesterday, telling them what to do. Most fevers are still malaria fever in Nigeria as of today, perhaps, and other things, typhoid and whatnot. And except for a history of contact, with someone who probably had Ebola, a child with fever is not Ebola. However, a child with fever still has to be, treated properly. And you don't want people resuming when the teachers are not ready, when they are not calm, when they are not, cool and collected about dealing with such situations. Because again, they might mishandle a child out of their fear, and not touch the child. Is fever, is this, is that, and that could cause us more problems. So I think it has to be a middle ground. Move it forward a bit, like the government is already saying they will do, but again, move it forward to where they are comfortable with, and to where the schools are comfortable with. Give it enough time for us to sensitize the school owners, the teachers, enough to know what to do.
Well, what are we doing in terms of possible treatment? Vaccines, the cure, research?
Well, again, these things take a long time to do. They do take a long time to do. We've had the unfortunate incidents in Nigeria for instance, before, where some treatment was tried in Kano, caused a lot of problems. So that should, I think, teach us a lesson about the complexity of this kind of thing, and we shouldn't be in a hurry. Really, with I think, in fact, with Nigeria's case, we've proved something very good. We didn't have ZMAP, and we have more survivors than fatalities. With many of the fatalities being related to maybe late presentation, not all of them, but I mean, so again, what we have shown is that this can be treated, successfully if you don't, even without ZMAP, without any wonder drug or vaccine from anywhere, we can handle this properly. What we need to be more concerned about, perhaps for the moment, is how not to let this increase in terms of incidence, how many more cases we get. How do we stop it at what we have now? So that nobody beyond the present contacts being monitored develops anything.